Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is America's rural healthcare shortage. So, believe it or not, 20% of Americans live in rural America. That's 66 million people. However, only 9% of doctors practice in rural America. So there's a huge shortage. More specifically, in rural America, there are only 68 doctors for every 100,000 people, yet in urban areas in America, there are 95 doctors for every 100,000 people. Now, in rural America, there's also a 20% higher death rate. Okay, so it's not necessarily like causation, but there certainly is a correlation between having a lot less doctors in rural America and having a higher death rate there. All right, now, specifically for maternity care, for OBGYN services, for like delivering babies, believe it or not, 50% of counties in America have 0 obstetric services. You cannot deliver a baby in half the counties in America. And that has associated problems as well. So the maternal death rate in rural America is 73 deaths for every 100,000 births. Yet in more urban areas, the maternal death rate is only 40 deaths for every 100,000 live births. So look at that. In rural America, the maternal death rate is almost twice as high as in more populated urban areas. Again, it's a huge problem. And listen, the government has known this for a long time, and way back in the 1970s, they actually created what's called a rural health clinic, an RHC designation, to increase reimbursement to rural physicians to try to get more physicians to practice in rural America and get greater access to healthcare services for people living in rural America. Okay, so what does that increased reimbursement look like? Well, there's some specific things that the practice has to do. Interestingly, it has to use nurse practitioners and physicians associates. It has to use what are called these advanced practice providers, or APPs, as sort of like force multipliers. So if you have a doc in that particular area, then you have additional clinicians that can see more patients as well, which is, again, super helpful in terms of having greater access to care for people in rural America. And then also the clinic has to have access to laboratory services. They could have to do phlebotomy to draw blood there, because you don't want to have somebody come into the clinic and then have to send them for an hour or 2-hour car ride to get their blood drawn. So there are the additional things you have to get the higher reimbursement as an RHC designated practice. And it's a lot of money. So in 2025, these RHC practices get $152 per visit, which is a lot. And it's scheduled to increase to $165 per visit. And they've already set out a schedule of further increases in subsequent years. This is at a time when many physicians are actually seeing decreasing reimbursement from the government and insurance carriers. And here you have an area where there's actually increasing reimbursement for physicians from the federal government. Okay, now this brings me to Moroka. So Moroka is a company that specifically partners with independent physician practices to keep them independent. And they have specifically partnered with an OBGYN practice in rural West Virginia that does not currently have this RHC designation, to actually get the RHC designation. And they modeled out what it would mean financially for this practice. And it turns out that at the 2024 patient volumes for this practice, that the RHC designation would get them an additional $24,830 per month, which is over $300,000 per year. Hugely meaningful for this practice. Now, this practice also has an older physician, and the increased reimbursement is also going to allow him to hire more staff and even offer a better sort of financial package for another physician to come in and take his place when he's going to retire. So it helps with transition as well, transition planning, because it is so important for this community to like keep this practice open. Okay, listen, I'm from the Washington, D.C. area. Our family used to go on like long weekend car trips, vacations to West Virginia. And listen, it's beautiful, but it's very mountainous, and it's got these hairpin turns and these winding roads that go up and over mountains. And like at night, there's like not street lights, so it's really dark, and there's not always guardrails. So like to the extent that people don't have to do these like long, fairly dangerous, in the winter, like we've been caught in a blizzard in West Virginia before, like it's not safe. Okay, so to the extent that you can keep the clinics close to people, that's hugely important. And Moroka and this clinic in West Virginia are going to make that happen. Now, specifically what Moroka does is they help create an ESOP, which is an employee stock ownership program, where the ownership of the practice is actually shared by all the employees employees so that they're all working together for the improvement of the practice. They also bring in a huge tech upgrade for the practice. A lot of these independent practices need new technology in all sorts of areas of their business. And then they help them get this RHC designation as well. So if you're an independent physician, especially if you're a rural independent physician, but even if you're urban too, just know that Moroka is there to help you, and it's an amazing mission, and I'm so happy to be able to share that with you today. Thank you for watching A Healthcare Z.